And this is a great question because, again, this goes back into most patients have never been through this. So what's normal, what's abnormal? And really your providers are going to be the best resource for this. And that's your doctors, your nurse practitioners, your PA, and your nurses, because this is what they're dealing with every day. When you cannot get in touch with those people, I say use reputable sources, American Cancer Society, Leukemia and Lymphoma Society. They have a ton of resources on those pages, and just making sure that you're getting factual, true information. But also just being cautious whenever you're using the internet as a source of information, just because we can't always say with 100% certainty how factual or true that is. But I just say lean back into your providers, and you're not a burden. Ask those difficult questions because this is your care and you need to be involved in that. So, as far as resources go, there is as we know, an abundance of information on the internet. And so I first and foremost just urge caution in using those resources. I tend to steer patients towards well-known resources. So in my world, it's Leukemia and Lymphoma Society or the American Cancer Society. I find that those have really good factual information, and they're not overly involved. I also use caution in support boards, because you're going to get a wide array of experience, and so you might have somebody who said this chemo was the easiest chemo I've ever had. But you might also have somebody who said it was the worst chemo they've ever had. And what we just know is that everybody's going to respond differently to different things. And so you kind of have to take it, with some caution on those types of things. But I just say, Leukemia and Lymphoma Society, American Cancer Society, and then any disease that you have diagnosis with, more than likely there is a disease-specific group that manages kind of information for patients and providers alike that you can likely seek out. In terms of mental health, I always steer patients towards a lot of the newer apps that are out there that focus on meditation and relaxation techniques. And so Insight Timer or Calm or Headspace, of just finding one that works for you and use that as a tool in conjunction with medication treatment or talk therapy, but just kind of using every resource you have to kind of help you with these things. But also just goes back to ask your providers if there's any in-person resources that are available, and never be afraid to ask for clarification on what a medication means, what a medication does, and what are potential side effects of that medication. Because anytime you put a medicine into your body, those should be that should be the information that is being conveyed to you every single time. And so make sure to hold your providers to that standard to say, hey, you're giving me this medication. How is this going to work? What can I expect from side effects? And is there anything I need to be worried about? So in the post kind of treatment phase, what I specifically look for is survivorship groups and long-term follow-up groups. I know at our clinic we have a long-term follow-up coordinator who will take the time to kind of look through and say, these are the things that we really need to follow up. And you'll get actually a laid out list that says, basically in the years to come, these are the things that we need to be watching for and paying attention to, and kind of the follow-up appointments that you should be seeking out as we move forward. If you can't find that with your provider, again, your disease-specific resources will have that. And then, American Cancer Society, Leukemia and Lymphoma Society have survivorship recommendations, but that is going to be a little bit more disease specific. Again, you kind of as you transition away from your cancer treatment, I would just say, lean back into your other providers of your PCP and establish a good relationship with them and be forthright with what you want to know. I basically went through this treatment. I'm at this stage of recovery, and I need to know what I need to be doing, as I move forward, to basically stay healthy as we move forward through the next months and years. And take some of that work off of yourself to have to get that information, and lean into your providers who that's really their job, is to make sure that you're receiving that appropriate care. But that being said, you're also, just make sure that you are asking those important questions of when do I need to have a pap smear? When do I need to have a colorectal exam? Should I be getting skin checks? And the answer is yes, you should, but timing will depend specifically on your disease and where you are in your treatment progress. So my favorite app of all time is Insight Timer. It's a meditation app that just has a multitude of free meditations, as well as some paid content, but you can use it very effectively without that. And I've had patients with excellent help with their insomnia that tends to come with cancer treatment, as well as with their anxiety. I think that's a great one to have. Using your note app to just write down stuff, because inevitably with chemo, you're going to have some forgetfulness. We call that chemo brain. And so just write down notes, write down messages to yourself, things like that. I think is super helpful. And then also look into, like we talked about earlier, the mental health resources. I don't have any one specific that I use, but I just encourage patients to find one that works best for them, that might work with their insurance, of getting you plugged into just some talk therapy, of somebody to just kind of talk through this. But those are kind of the big apps that I use and recommend patients use more frequently. So obviously using Google, you can sometimes find your way to free resources. A little trick that a lot of people don't know is, a lot of times if you want access to an article or a study, if you email the study collaborators, a lot of times they will grant you free access to that. They a lot of times do not enjoy that their information is hidden behind a paywall, and are more than happy to oblige in providing that information out there. And then again, if there's something else that you wanted to see, use your nurses, use your advanced practice providers and your physicians, and just say, hey, totally, you guys are making, we're working together to make these decisions, but is it possible for me just to see the research paper on this? For me, I'm happy to provide that to you. My only ask is that you not make any assumptions based off of it, because there's a lot more that into the decision-making process than just what's in the paper. And so it can be slightly misleading in some sense. And so I just say, yeah, please do your research, please be an informed patient, but also with that information, just make sure that you are clarifying and verifying any assumptions with your provider and your medical team.